Good afternoon. We are going to get started here. I'd like to welcome you to this bidders conference for the Pennsylvania Nursing Pathway Apprenticeship Industry Partnership Grant Initiative. The purpose of this meeting is to provide you with information as detailed in the Nursing Pathway Notice of Grant Availability, which was released on October 24th, and of course to allow for questions from you. My name is Sam Premack, and I am a Workforce Development Analyst for the Apprenticeship and Training Office. I will be managing this grant program, serving as your point of contact for questions and technical assistance. I believe Director Tara Lowe will be joining us shortly. She may also have to hop off a little early, um, but we may have an opportunity to hear from her a little bit later. A few housekeeping items that I'd like to cover before we begin. I do want to let you know that this bidders conference is being recorded. We ask that you enter your questions using the chat feature. You can feel free to enter your questions throughout the conference. We will provide answers to these questions or do our best to provide answers to these questions during the question and answer period at the end of the conference. Everything that is being covered today is included in the NGA, apart from the questions and answers, which we will transcribe and post on the website, L&I's Grants webpage in the near future. So with all of that said, I'd now like to begin with a brief introduction of this initiative. So as with most of the country, Pennsylvania has not been spared the devastating effects of the COVID-19 emergency. While confronting the public health ramifications of the pandemic, the Commonwealth also faces lasting challenges in addressing economic harms to specific industries and households. Industries in the travel, tourism, and hospitality sectors immediately come to mind as having been most impacted by the pandemic, and many of these industries are on the path to recovery. However, Pennsylvania's healthcare industry faces significant and ongoing challenges, particularly with an unprecedented shortage of nurses. In a recent survey of 6,000 nurses conducted by the American Association of Critical Care Nurses, 66% of participants said the pandemic has caused them to consider leaving the profession. A further 92% agreed that the pandemic has depleted nurses and shortened their careers. Additionally, a survey of Pennsylvania hospitals conducted by the Hospital and Health System Association of Pennsylvania in 2021 confirms that high vacancy rates are indeed prevalent across numerous nursing occupations. Specifically, there is a 45% vacancy rate for nursing support, a 32% vacancy rate for clinical nurse specialists, a 30% rate for certified registered nurse practitioners, a 27% vacancy rate for registered nurse staff providing direct patient care, and a 22% vacancy rate for certified registered nurse anesthetists. The Commonwealth's economy is on a track to a strong recovery. However, much work remains to continue building a robust, resilient, and equitable economy in the wake of the crisis, and to ensure that the benefits of this recovery reach all Pennsylvanians. So while the pandemic impacted millions of households and businesses, some of its most severe impacts fell on low-income and underserved communities, where pre-existing disparities amplified the impact of the pandemic, and where the most work remains to reach a full recovery. Likewise, the pandemic caused disproportionate impacts in certain communities. According to data from the Center for Workforce Information and Analysis, low-income and underserved communities throughout Pennsylvania faced more severe economic outcomes, like higher rates of unemployment, often because pre-existing disparities exacerbated the impact of the pandemic. Low income and underserved communities also faced more severe health outcomes, like higher rates of COVID-19 mortality due to pre existing disparities. Recognizing an opportunity to address parallel challenges and identify common solutions, the Commonwealth has taken a strategic approach to recruiting, onboarding, and retaining qualified healthcare professionals through registered apprenticeships while serving communities most impacted by the pandemic. As part of the American Rescue Plan Act, coronavirus state and local fiscal recovery funds are key to supporting Pennsylvania's recovery and reemergence from the COVID-19 public health emergency. Specifically, these funds will ensure that state and local governments have the resources to fight the pandemic and support families and businesses struggling with its public health and economic impacts, maintain vital public services, even amid declines in revenue, and build a strong, resilient, and equitable recovery by making investments that support long-term growth and opportunity. In September 2021, Senator Maria Collette announced the COVID-19 Nursing Workforce Initiative, funded through the American Rescue Plan Act, as a plan to support and retain nurses across the Commonwealth as they continue to navigate numerous challenges brought on by the pandemic. Specifically, this initiative will provide funding to be administered by the Department of Labor and Industry, or L&I, for apprenticeships and industry partnerships in impacted communities with a focus on mentorship. As part of this initiative, L&I is taking a unique approach to blend the apprenticeship and industry partnership models by supporting the creation of nursing pathway apprenticeship using an industry partnership approach throughout the Commonwealth. Through these efforts, businesses will have the option to partner and form an industry partnership to build one overarching apprenticeship program serving multiple employers. Industry partnerships provide a strong avenue for convening employers and developing a group sponsor model of apprenticeship. In a group sponsor model of apprenticeship, a sponsor organization brings employers together and helps them jointly prepare and register an apprenticeship program to train people to develop necessary job-related skills. Involvement from local workforce development boards is vital, not only in convening industry partnerships, but also in bringing necessary partners together and supporting the group-sponsored apprenticeship model. Workforce development boards also have the unique ability and capacity to provide leadership to all key regional partners and develop effective apprenticeship industry partnership ecosystems. L&I announced the availability of approximately $1.2 million in funding for awards of up to $260,000 each to support the convening of nursing pathway apprenticeship industry partnerships in low or moderate income communities and guide the development and registration of healthcare apprenticeship programs with emphasis on nursing occupations through group sponsorships. Such occupations include, but are not limited to, home health aides, certified nursing assistants, and licensed practical nurses. Within the scope of this grant program, grantees are not required to serve as the group sponsors for the apprenticeship programs. However, grantees are expected to guide the project and work with respective regional industry partnerships to successfully register, maintain, and manage nursing apprenticeship programs. We are seeking applications from workforce development boards to act as conveners and assist in the building of group-sponsored apprenticeship programs across Pennsylvania that recruit employers to participate in the group apprenticeship model and recruit participants, either incumbent or new to the field, prioritizing those who reside and/or work in low or moderate income communities. The goals of this initiative are to continue fighting the pandemic and support individuals and families struggling with public health and economic impacts. Build a strong, resilient, and equitable recovery by making investments that support long-term growth and opportunity. Further support individuals in nursing occupations and increase retention rates within nursing occupations. Again, applicants are reminded that this initiative is all-encompassing with regard to nursing occupations. Such occupations include, but are definitely not limited to, home health aides, certified nursing assistants, and licensed practical nurses. We want to encourage pathways to enter into nursing occupations. And with this initiative, we want to develop career pathways for advancements in nursing occupations. We want to enhance outreach to employers in the healthcare industry. We want to increase regional collaboration to support business and worker needs within the healthcare industry. We want to expand workforce service delivery to new employers. We seek to connect job seekers to local employment opportunities. We want to create sustainable programming for future use. Priority of this grant program is reaching underrepresented populations to increase equity through supporting pathways to quality employment. Applicants are reminded that equity is distinguished from equality. Whereas equality means providing the same to all, equity means recognizing that not all start from the same place, and steps must be taken to address existing imbalances. Eligible applicants for this grants initiative are workforce development boards. Applicants must demonstrate the ability to bring together regional healthcare businesses to support the overall project goals of this NGA. Applicants are encouraged to demonstrate a plan to assist in the recruitment of individuals in low or moderate income communities to participate in apprenticeship opportunities. Applicants must also demonstrate the ability to coordinate the project design and implementation of the project, manage the project budget, and implement a strategy to collect, analyze, and report performance outcomes. Workforce development boards may partner and apply under this initiative. However, a lead applicant must be identified in this instance, and it is highly encouraged that partnering workforce development boards have close geographical proximity. The Workforce Development Board applicant will serve as the fiscal agent for the project. Please note, for workforce development boards that choose to partner and apply under this initiative, a lead must be identified to serve as the fiscal agent. And as stated earlier, this opportunity is funded through the American Rescue Plan Act. So now we're just going to take a look at the project outcomes per grantee. The Workforce Development Board, as the grantee, will coordinate, launch, and lead new nursing-focused industry partnerships. The Workforce Development Board will also identify and dedicate at least one staff member to act as project manager on a part-time to full-time basis for this initiative. The Workforce Development Board will act as the fiscal agent and administrator of apprenticeship and industry partnership funds. Using a group sponsorship model, industry partnerships will work to develop and register at least one new nursing pathway apprenticeship program. The overarching goal for any programs developed and registered through this initiative would be to serve at least 20 apprentices annually beyond the period of performance. 40 new apprentices must be registered and reimbursed for on-the-job training and related technical instruction at a rate of $1,500 per apprentice over the course of the period of performance. The programs in which these new apprentices are registered can be new and/or currently existing programs. 20% of apprentices, upon completion of their program, must remain with the employer who provided their training. The Workforce Development Board will assist in the creation of mentorship training to be used to train identified mentors or journey workers, with the expectation that all established mentors and journey workers participate in said training. In addition, grantees are expected to create a sustainability plan to continue mentor training beyond the period of performance and for as long as the program is running. The Workforce Development Board must create and administer a reimbursement process applicable for use of these funds or other workforce funds for applicable registered apprenticeship sponsors. This process would be designed to assist in incentivizing the creation of registered apprenticeship programs and/or recruiting from populations traditionally underserved in registered apprenticeship. The Workforce Development Board must also assist in the development of presentation materials that will help apprenticeship employers and job seekers see the relevance and value of registered apprenticeship. The Workforce Development Board must support the program building and registration process. Specifically, boards must help apprenticeship program sponsors to develop apprenticeships for registration. While this NGA emphasizes a group sponsorship model, applicants are not necessarily prohibited from proposing single or joint sponsored models. Workforce development boards must ensure the requirement elements and standards of registered apprenticeship are met. They must devise a plan to facilitate the development of training plans, work processes, and related instruction that are acceptable to both union and non-union employers for implementation. They must develop and support existing committees' customized courseware for training delivery using a train-the-trainer approach. They must create strategies for employers to develop career pathways, industry credentials, and articulation to technical and community college credits, and assist in development of systems that help maintain records on individual enrollees, including contact and emergency contact information, demographic information, veteran status, education information, and assessment results. Boards must assist in the development of a tool to assist with the maintenance of participant records, to include start and completion dates for each service received. Boards must support development of processes and procedures to maintain case management records, outcome data including employer names and addresses, journey worker job title, wages, educational success, credentials received, 6 and 12-month retention and career wage advancement data. And finally, boards must create a plan to help employers develop recruitment strategies for non-traditional and traditional apprentices into registered apprenticeship programs. This includes the development of strategies to recruit women, minorities, limited English speakers, veterans, older workers, and other underrepresented groups into apprenticeship programs. This development should include methods to help strengthen relationships with community-based organizations, focusing on serving underrepresented groups, in order to help employers recruit new employees for career pathway occupations in nursing. So now we will touch upon evaluation criteria under this NGA. Applications will be reviewed and evaluated by an interagency team. I ask that you please refer to the NGA for specifics on the evaluation criteria. We have, however, included a breakdown of the criteria on this slide. The Pennsylvania Nursing Pathway Apprenticeship Industry Partnership NGA and all related materials are available on LNI's grants website, with the link here on this slide. Applications must be complete including all required documents, and submitted by 5 p.m. Eastern Time on November 30th, 2022. An electronic copy of the application and all required components must be emailed to the ATO Grants at pa.gov resource account with the email subject Pennsylvania Nursing Pathway Apprenticeship Industry Partnership Application. All applications must be single-spaced on 8.5 by 11-inch paper with 1-inch margins using 11-point Calibri font. All application documents must be in portable document format, we know as PDF, with the exception of the budget form, which must be provided in Excel format. Page numbers must be provided in the footer. Documents may not include internet addresses that provide information necessary to review the application. Documents must not include any proprietary or sensitive business information, as Pennsylvania may make it available to the public. Incomplete applications or applications that do not meet these specifications will not be evaluated or scored. If a project narrative is more than 10 pages, evaluators will only review the first 10 pages. I just want to take a moment and direct you to the application components that must be completed. We have a project summary page that can be found in Appendix A of the NGA. We have the apprenticeship application form, which can be found in Appendix B of the NGA. The project narrative must include details addressing all of the evaluation criteria, which can be found on pages 9 through 11 of the NGA. Applicants must submit a detailed budget that includes expenditures by line item. The budget will be evaluated based on evaluation criteria and in terms of cost reasonableness and the relationship to proposed activities. Budgets must be for the time period of April 1st, 2023 through June 30th, 2026. The budget will also become the financial basis for any grant award, including making cost reimbursement payments over the course of the project. The budget form is available in Appendix C of the NGA and does include examples. Also, be sure to use Appendix D of the NGA, which focuses on FSR cost categories, as an additional resource when completing the budget form to assist with titling and defining each available cost category. In addition, information on allowable and unallowable costs can be found on page 13 of the NGA, and information on program expenses can be found on page 14 of the NGA. Here we've included a snapshot of the budget form. You can see that the budget type is separated into admin and program costs, with specific subcategories for administration, career and supportive services, and training. Again, the FSR cost category will assist with titling and defining cost categories and is an additional resource that we've included in the NGA. Applications must also include completed budget justifications. Each expenditure must be justified by line item, including the cost proposed in each category, as well as any other information to support the budget. Budget justification instructions can be found in Appendix E of the NGA. Each application must have no more than 5 letters of support. Each letter should state how the proposal will help address the problem and goals of this NGA and its impact on the target populations and community. Applicants must describe desired outcomes of proposed initiatives and how they will be measured. This component should include measurable goals, outcomes, services, performance indicators, evaluation methods, target numbers to be served, and a timeline to meet the goal or outcome. Applicants should use the goals and outcomes table found in Appendix F of the NGA. And here we've provided a snapshot of the goal and outcomes table. And finally, we ask that applicants provide a project timeline, including implementation steps, deliverables, and how those deliverables address the desired outcomes of the project. The timeline should be broken down by each quarter within the grant period. The template for the timeline can be found in Appendix G of the NGA. And this template is also included as I believe, a fillable Word document online. For your reference, we've included a snapshot of the timeline template. We do ask that applicants describe how project partners will sustain the project beyond the grant period. We have included a sustainability plan template as Appendix H of the NGA that we ask applicants to complete and submit. And we will also ask that applicants submit written policies and procedures and specifying the types of supportive services allowed, the maximum amount per person, governing the award of supportive services, and must ensure that each supportive service payment are tied to the goals of the specific program and align with the local program's organizational policies. And finally, pursuant to Executive Order 2021-06, which is the Worker Protection and Investment, contractors and grantees of the Commonwealth of Pennsylvania must certify that they are in compliance with Pennsylvania's unemployment compensation law, workers' compensation law, and all applicable Pennsylvania state labor and workforce safety laws. The Worker Protection Certification Form is included as Appendix I in the NGA. And again, I do believe many of these documents referenced are also included as separate attachments on the LNI Grants webpage. Apprenticeship programs funded by this grant must be registered in the Commonwealth. Non-registered apprenticeship programs will have until September 2023 to finalize their registration or show significant progress towards the finalization of the registration. The ATL will define making progress towards registration on a case-by-case basis. And as a reminder, additional information on program expenses can be found on pages 14 and 15 of the NGA. Again, LNI anticipates a performance period beginning April 1st, 2023 and ending on June 30th, 2026. Awardees are required to enter into a workforce grant agreement with the Commonwealth of Pennsylvania. Workforce Development Board awardees are to be funded under their current Workforce Development Area Grant Agreement with dates of July 1st, 2021 through June 30th, 2024. Additional information can be found on page 15 of the NGA. Grantees will be required to submit program and fiscal progress reports during and upon conclusion of the funded project. All projects will be required to do a pre-evaluation and post-evaluation of the project. All required forms will be supplied by the ATO and will be outlined in the award package. All closeout final reports are to be submitted no later than August 31st, 2026, or within 60 days of full award expenditure, whichever occurs first. For additional information on reporting and evaluation, I ask that you please see page 16 of the NGA. And that concludes the specific and general grant information portion of the Bidders Conference. We will now get to the more exciting part, which is the question and answer portion of the Bidders Conference. I will be exiting out of screen sharing mode, and will read through the questions that have been entered through the chat feature in the order received. Please note that I will do my absolute best to answer all questions. In the event that there is a question that I need to do a little more research on, just know that that question will be answered subsequently in the question and answer document when it is posted. So as of now, I see no questions that have been entered into the chat. I will give it another minute or so to see if anyone has a question to enter. Okay, I see Nancy and Gina entered a question into the chat, and that question is, what is considered low to moderate income community? So under the American Rescue Plan Act, as their final rule defined it, that would actually be a community where the median household income is under 65,000. So that is kind of the standard at which we would ask our grantees to um, follow as well. Um, and we are actually not necessarily looking to have you hone in on specific communities. We would also, and this is permissible under ARPA, to kind of look at that at a county-wide level, if you will. So um, we would actually allow you to consider a county-wide um, measure there, and that would essentially be $65,000 less, $65,000 or less as a median household income for a specific county or specific community. There's a lot of flexibility there in terms of how that's defined, um, thanks to some of the language and the guidance provided through the American Rescue Plan Act. And again, that's a major emphasis. We do want to focus on low to moderate income communities, and um, but again, we allow for a lot of flexibility there. Whether you look at that as a specific community, or if you want to look at that as a county-wide measurable. Additional questions. And I will actually now open it up. If anyone would like to just unmute themselves and ask questions, we can also handle it that way. And of course, we will also um, ask or allow for questions to be submitted through the ATO grants resource account too. So just know this is, if you think of any after the bidders conference has ended, you are more than welcome to send those to our resource account. I did see another question come in from Patty. What registered health care apprenticeships already exist? So that's a very specific question. What we can do is we could kind of take that on a very case by case basis. I can follow up with my team here, Patty, and we could try to get that information specific to your area. And um, I would like to extend that offer to anyone else who is interested. We could certainly provide that specific information for your areas. So Patty, the short answer there is I will get back to you with, or I will have our team get back to you with information. Again, I will open the floor for any questions, whether you want to enter it through the chat or if you would like to unmute yourself. Okay, Patty, I think I see you followed up with an additional question. Does the industry partnership have to be new or can be part of an existing healthcare industry partnership? Does not have to be new. It can be part of an existing healthcare industry partnership. So no to the first part of your question and yes to the second part of your question. Again, any other questions, I'm happy to answer now. We will have other opportunities by way of the resource account. And very similar to, for those who are familiar with the Apprenticeship Building America um, grant opportunity, we may also open this up for open office hours, similar to what we've been doing for ABA, where we will post or send out a message indicating a time where we'll just be available to answer any questions that you would have. Okay, well, hearing no additional questions, I will give one more opportunity. Okay, so seeing none, hearing none, I want to extend a very sincere thank you for joining us today, this afternoon, for this Bidders Conference. Again, any additional questions that you may think of after disconnecting from the call today, please feel free to send those to the ATO grants at pa.gov resource account. We're more than happy to answer those as they come in. For the questions that were asked during today's call, we will transcribe the questions and answers, and then we will go ahead and post that document along with a recording of this Bidders Conference. Again, I want to thank you all for joining us. We truly appreciate your interest in the nursing pathway opportunity, and everyone have a wonderful afternoon and evening. Thank you.